guys, it's your girl Asha, and this is another episode on my podcast, Living Beyond the Matrix. And today I have a special guest, a nurse that I know personally. I'm going to let her introduce herself, and I'm going to ask her a few questions to pick her brain.
Hi, my name is Ayana Guyan. I'm a registered nurse here in Texas.
Alrighty. So, first thing we're going to ask you, how's your day going?
It's good, girl. It's good. It was a little hectic today at work, but it was good.
It always is. So, first question I'm going to ask you, I'm going to go into your background a bit. What made you pick the field that you're in, and what is that field?
So currently right now I'm in advanced labor and delivery nurse. I just applied to be a midwife. What made me want to get into this field was basically, I know that women of color are not treated how they should be in the hospital, and I wanted to be an advocate for them, as well as helping them to understand their rights as far as what they are entitled to, as far as how they are supposed to be treated, and the things that they are supposed to be getting done while at the hospital or being cared for. Yeah.
Alrighty, so what was your personal birthing experience, if you don't mind us asking?
So I have two boys. My first birthing experience was really crazy. It was really hectic. I was in labor for about 36 hours, which is a very long time. I had a couple of complications, especially with nurses not believing that I was actually in pain. I don't know if it had anything to do with color, but I have heard of that so many times, of other women having a problem with them not telling them, people, that they are in pain, and them not accepting that this is pain and it's not pressure. Luckily that my mom was there for me. She was able to tell them, like, hey, my daughter's in pain. Yeah, my second kid, it was a little bit more not extreme. I was only in labor for 8 hours, but I did pass out a couple of times, and I did have some problems with the epidural. And that's also another reason why I got into this field, because I want women to know that you do not have to go to the hospital to have a wonderful birthing experience. It's not something that's mandatory. You can have a birthing experience at home and it be as smooth as if you were at the hospital, if not smoother.
Alrighty. So I know a lot of my viewers some of them are going to be nurses. I get chats about it all the time. Mm-hmm. So I'm pretty sure they want to know, how do you get into this particular field?
So I started off at a community college. I went there for about 2 years, and I did all my prereqs, and then I went on to I can't even talk right now, Prairie View University. Once I moved to Texas, and after I did 2 years, I was able to hit my bachelor's, and then I went into the nursing program. Now the nursing program is based upon you and your grades. It could be up to 2 to 4 years, depending on you. For me, it was only 2 years. So that means with everything, I think about 6 years. It was a long time, but it is a very rewarding job.
Alrighty. You told us how long it takes. I know somebody's gonna ask, well, how long will it take? It takes from anywhere from 4 to 6 years?
6 to 8 years. That it honestly depends on you, because there are some people that do take college classes while they're in high school. I did not. I was playing in high school. I'm not gonna lie to you. I was playing. I was playing in high school. And I think I want to share this part.
Yeah, go ahead.
I did not graduate high school. I played all 4 years of high school. I ended up getting out of high school, and after I got pregnant with my first kid, I went and got my GED. So I want to let people know that it does not matter what background you come from. It doesn't matter if you get a GED or a high school diploma. It doesn't matter. I didn't go to college until 10 years after I graduated high school. So don't be afraid of looking at your age and be like, oh my gosh, there are so many younger kids, younger girls, or younger men doing this. It does not matter. It's all about your determination and your motivation.
Of course. So it sounds like you're very empowered and you feel very confident within yourself.
Yes, and that took some time to actually get into, because I didn't used to be like this. It took a long time to become this person. And I think how life played out, that's how I was able to get into, being this confident. Because I used to, when I was in, at Valencia, I was like, these people is gonna be looking at me like, girl, you old. Don't be coming in here. I thought it's gonna be hard for me to get into nursing school because it's people that are coming straight out of high school and school is fresh on their brain. That is fresh on their brain. So I'm like, dang man, I'm gonna have to be competing with these younger people, and they are easier to teach or easier to learn because they fresh. They just got out of high school. So but yeah, as long as you have that determination, you are good.
All right. So, what do you like most about your job?
What I like most about my job is being able to actually help women. When I say help women, I mean as far as being their advocate for, pain, or being an advocate for, things that they don't know about. Like, a lot of people don't know that that you're supposed to do delayed cord clamping. A lot of women don't know that you are supposed to keep your placenta. A lot of people don't know that the hospital where I work at, and I don't know, I probably will get in trouble for saying this, but I'm gonna go ahead and say it because, like I said, I'm an advocate for my people. The placenta that people tend to throw away, the hospital keeps that, and they sell that to richer people.
Can you talk about the benefits? I'm sorry to cut you off.
No, you're good.
Yeah, the benefits of the placenta is why.
So basically, the benefits are that placenta is all the nutrients that are taken from you, and they're supposed to go to your baby. Once they sever that cord, those nutrients no longer go to that baby. That's why I said the delayed cord clamping. Now, being that this baby has taken so much from you, the placenta is basically supposed to be yours. You're supposed to, some people cook it. I'm not doing that personally. I would say dehydrate it and put it into capsules and take it because this is yours. These is your nutrients that was being taken to provide for your kid. So it's supposed to be, given back to you as far as because when you have a kid, your baby takes the calcium out of your teeth, out of your bones,
and you lose them.
And you will lose them. That's why women be like, oh my God, having a baby broke down my body. My back is hurting. And then you go in, you're not taking care, you're not eating healthy, you're not eating the stuff that you're supposed to eat. And then you're going in and having an epidural that's even more straining on the body. Now your back is hurting, your legs are hurting, and you're supposed to take this placenta and put those nutrients back into your body.
All right, thank you for the information. And what do you like least about the everyday job?
Oh, absolutely. I got this hands down.
All right.
The death.
Oh.
That is by far the
Black women. I did hear it's higher for us.
It is definitely higher for Black women for a lot of reasons. They don't have many advocates. A lot of women are doing this job for the money and not for the love of the job. There's not enough attention to detail to what's going on. You have to be, and as a Black woman, we are taught to be strong all the time. So even when we hurt, oh, I'm okay, I'm fine. And you have to be pay attention to detail and know that just because my patient is saying that they fine, I'm looking at them and I can tell that they aren't fine. Versus just saying, okay, she said she's fine, so I didn't, and you can catch something by paying attention to a person or just looking at their body language. And that's why I say a lot of people are doing this job for the money and not for the love of the job.
So in this field, or even in life, what is your end goal?
So my end goal is I started off being a doula, and then you don't have to go to school to be a doula. You just have to get a certification. It's about 6 hours for that class. My end goal is to have a birthing center of my own where I can help people that are not even just women of color. I want to help people that are less fortunate and don't have, the money to go out and get their own, midwife and their own doula. They have to go to, the health department and get, that type of, and a lot of times the health department and, what can I say, like midwives or OBs that accept Medicaid and stuff like that, they have so many patients to care for. So they're not, they don't have this personable relationship with them to get to know them, to know that, hey, my patient, something is wrong with my patient. I want to be able to have my own where I'm able to advocate and let these women know this is what you need to be doing. this is what it takes. A lot of women are just having a baby, and it is just having a baby. They don't know what all comes into having a baby. Like, for me, I remember being pregnant with my first son, and I have O negative blood type. O negative blood type is one of those blood types that they call it, like, you know, basically like liquid gold. You can donate blood to anybody. And I remember my mom being with me, and a nurse asking me, had I got this particular shot, and I hadn't got that. If you're pregnant with a child and your child does not have that particular blood type, O negative will treat that baby as a parasite, and it will literally tell your body to terminate this pregnancy if you do not get this shot. And being that I was at the health department getting care, I did not get that shot, and I could have lost my child as well as lost my own life. And that is due to negligence, and it's so many women that go through that. So, like, yeah, that's my end goal, to be able to advocate and help these women so they know what is available to them, so they know, like, hey, this is what I need to do. I need to have this. I got this blood type. You know how many people don't know their blood type?
I don't know mine, guys.
You need to go figure it out.
I think I should.
It's very important. And also, you know, if you're a very healthy person, go out and donate some blood, please, because we always need it. You never know.
Exactly, you never know. Now, what advice would you give somebody like me who has no idea as to what they're getting into? They don't know the attitudes of the field. They don't know the ins and outs of the field. They have no background of this, but they know that they want to help people in the way that you help people.
What do you mean, like as just being an RN, or as far as like a labor and delivery nurse? So I would say being a RN, school is hard, and I don't want you to get, once you finish school, to get into the mindset of you thinking that, oh, it just all stops. It does not stop. When I got into this field, I thought that, you know, once I finished school, it was like, no, it's like a whole nother year. It's like being a freshman in high school. You know how you, freshman, and that's exactly how people treat you. I hate to say it, but the nursing field is really, really hard when you are a rookie. And unfortunately, they're bullies. I gotta be the one to say it. They are. I'm not one of those people, because that's just not how I operate. I want to help everybody, especially somebody that's new. I want to be able to, if you need help, come to me and ask me for help. As far as labor and delivery nurse, I need you to know that going into this field, it is not always a happy ending. Now, and I can't even say majority of the time it is a happy ending, because it is not. You have to understand that you could be talking to a patient 1 minute,
And
they can be gone in the next. This person could be holding their baby 1 minute, and their baby could be. And there is literally nothing you can say to that mom, especially to the mom that has lost a kid. But there is nothing that you can say to a family member that is going to make that blow easier at all. So you have to know that, you have to understand that with any job, there is going to be good and bad, but we see death a lot more than, you know, the average, and we spend a lot of time, you know, even though we don't know these people most times, coming in there and having a baby, we're spending, like I said, I spent 36 hours in labor. So I spent 12 hours with a nurse, and being that, and just the, you know, so I would say when you go into this, you got to make sure that you okay in the mind.
Alrighty, guys.
13 minutes? Damn.
I need to get the wrap up video.
Right. I could edit it.
Oh. Alrighty, guys. So that was one of my lovely friends. Nurse who? Nurse what?
Nurse Diane.
Her title is it just nurse?
Oh, I'm an advanced labor and delivery nurse.
Alright. Closing out with the advanced labor and delivery nurse, Miss Ayana Guyan. If you guys have any questions, I'll be for information below. You guys can ask her questions. She's always willing to
Please
help.
look out. Watch. please reach out to me. I'm always available to answer any questions about this. If you have any questions about, you're pregnant, you have some questions you want to ask, just let me know, and I'm ready to answer them. I have no problem answering them. I'm always here to help.
Alrighty.
I got my show for Janae.
Hi, y'all.
You can turn